Hello everyone, welcome back to Grey Matter, your one-stop shop to all your exam preparation needs. Today the domain that we are going to discuss is sexual health, and sexual health is one of the very important domains that are associated with the UKMLA exam, and the presentations are usually very simple and very easy. And as you can see from this list, that the list of presentations is very limited, and the conditions are usually associated with STIs. So let's get on with it. The first presentation that patient can present with is erectile dysfunction. Now, in cases of erectile dysfunction, the patient, in this case of erectile dysfunction, the patient will present. It can be an elderly patient, it can be an adult patient, and they will present with erectile dysfunction. Now, it can be resolved due to a number of causes. It can be due to any particular drugs, it can be due to any disease, or it can be due to stress. So it is one of the leading causes of the stress is one of the leading cause of erectile dysfunction, and especially in the case of UKMLA, they usually show a scenario in which there is an old man, and he has retired from his job, and he has no interest in his hobbies, and he's also suffering from erectile dysfunction. So in this case, it can be due to the stress, it can be due to depression that is causing the erectile dysfunction. So you're going to counsel them regarding mood elevation techniques. Then there is loss of libido. Now this can occur as a result of any disease, drugs, and depression. Now both of these are as a result of any disease, any drugs, or any depression, so you're going to rule that out in your history part. Now the remaining parts, the remaining presentations, they are associated with STIs. So if a patient has painful sexual intercourse, if the patient has urethral discharge or genital ulcers, if the patient has vaginal discharge, patient has vulval itching, or patient has any lumps, vulvar lumps. Now the lumps is associated with cancer. So the rest, we have talked about flaws, any fever, lumps and bumps in the body, loss of appetite, weight loss, and night sweats. So the lumps, you'll always think about cancer first. So in these cases, the painful sexual intercourse, the urethral discharge, the vaginal discharge, and the vulvar itching, it can be associated with various STIs, some of which are chlamydia, gonorrhea, and syphilis. So they are differentiated based on some particular symptoms, particular investigations, and culture. So whenever a patient presents with painful sexual intercourse, urethral discharge, or vaginal discharge, or any itching down there, always think of STIs. You have to take a complete sexual history, which includes a number of partners, any travel history, any use of protection, change in partners. So you have to take a very descriptive sexual history of the patient in such cases. So as you can see, this is a very brief topic, but it is a very important topic, and it can cover about one station in your UKMLA journey. So thank you for watching the video. If you have any questions and if you have any queries, you can always refer to our Grey Matter Facebook group, or you can join our WhatsApp group for regular updates and mock